Hello everyone, myself Dr. G Shanmugasundar, consultant endocrinologist at Magna Clinics, Chennai. So thanks for joining on Sunday, thanks for taking your time. So today mainly I will be discussing on a very important topic, that is the diabetes during pregnancy. So there can be two types. First of all, we know that diabetes is nowadays very common and many people are developing diabetes at a younger age. So we are seeing many patients who are already established diabetes getting pregnancy, and also during pregnancy some patients are getting diabetes. So these two things are different, that is a diabetes patient getting pregnant and in pregnancy development of diabetes, that is called as gestational diabetes. So mainly I will focus on gestational diabetes, briefly about the diabetes patient getting pregnant. So if you are already diabetes and planning for pregnancy, the foremost important thing is bring your blood glucose under good control before planning for pregnancy. I am saying again, get your blood glucose under control before planning for pregnancy, because it's very important, because the first 3 to 4 months is the time for organogenesis, that is the baby develops its heart, kidney, brain, spinal cord, all these things in the first 3 to 4 months. So if blood glucose is not controlled before or the initial part of pregnancy, then it can affect the baby development. So it's very important, keep your weight, keep your glucose, or if you have BP or other any complication under good control, and consult your gynecologist and take folic acid at least 2 to 3 months before planning for pregnancies. So we should avoid mostly from our side, we should give almost most protection to the baby, so that we have a healthy baby. It's very important. If your diabetologist or endocrinologist advises you for insulin, go for it. It's very essential, because during pregnancy we don't give many drugs. It's mostly going to be lifestyle modification plus insulin only. So if they advise you for insulin, better go for it, because it's going to help your baby to develop the normal organs, and also for you to have a healthy baby, because the baby's health is the first concern. So we have to, it's very important. So control your glucose, discuss with your diabetologist and gynecologist. Coming to the second part, that is the gestational diabetes. So who are at risk for gestational diabetes? So people who are obese, suppose your BMI is more than 23, they are at risk for gestational diabetes. Strong family history of diabetes. If father or mother are having, or siblings are having diabetes, they are also at risk for gestational diabetes. People who are diagnosed with PCOS, that is polycystic ovaries, if they have cyst in the ovary, then they are at risk for developing gestational diabetes. And in the previous pregnancy, suppose if they have delivered a large baby, 4 plus kgs baby, they are also at risk for developing gestational diabetes. And many other factors, if patient is taking some steroids which can aggravate the blood glucose, alter the blood glucose level, and if patient is hypertension, all these patients are at high risk for the polycystic ovaries, gestational diabetes. And the age, if the age is more than 30 years also, then we should check the glucose periodically, because they are also at risk for developing gestational diabetes. Usually gestational diabetes develop in the mid pregnancies. So, and the criteria are different. If you see the people without pregnancy and during pregnancy, the diagnosis and targets are different. So don't go with the lab reference range. That will be for normal people, not for pregnant people. So many people used to say they will have fasting 110. The lab reference range will be 70 to 110. So they will think it's a normal for them. It's not like that. In pregnancy, even if fasting plasma glucose is more than 92, it's significant. Okay. So any value, any glucose value, show to your gynecologist or your physician, and make sure that it is within the normal range. And your doctor may ask you to undergo the glucose tolerance test also. So if they advise so, go for the blood testing, and also show the reports to the doctor immediately. Don't wait for 2 or 3 weeks to show the reports to the doctor, and make sure that they say whether it's normal or abnormal. So if suppose the pregnant woman is diagnosed with gestational diabetes, what next? The most important thing in the gestational diabetes is lifestyle modification, because 90% of the pregnant women with gestational diabetes, the glucose can be easily controlled with lifestyle modification, change in the dietary pattern, and exercise. Exercise always discuss with your gynecologist, because you may be having underlying some pregnancy related complication. So if they allow you, go for the prescribed exercise. And dietary modification is very important. Most of the patients we can control with dietary modification. If still it is not within the target range, then we have to go for the insulin therapy. So Usually insulin therapy in gestational diabetes will be till delivery, and most of the patients we can stop the insulin after delivery. And monitoring is also very, very important. Patients on insulin or not on insulin, monitoring, frequent monitoring is very, very important. And the target range are also different for the pregnant woman. In normal, without pregnancy, we may target fasting less than 120 and postprandial less than 160. But in pregnancy, the targets are completely different. Fasting should be less than 95 and 2 hours postprandial should be less than 120. So discuss your target also with your doctor, and you follow the regimen accordingly. So why we are concerned? What is the importance of gestational diabetes? So initially diabetes, patient getting pregnancy, I told there can be damage to the organs. But in gestational diabetes, we are worried about the baby's weight, because usually due to the diabetes, the patient, fetus may be overgrown, so it can lead to macrosomia, that is a big baby. So there is high chance of cesarean section, and there is chance of shoulder dysplasia, because if some big baby comes out through normal delivery, the shoulder can be displaced, shoulder dysplasia. So high incidence of cesarean section, these are the very important complication. And also the pregnant woman can develop hypertension and preterm labor, all those things during pregnancy. And then the kid, they are also more prone for the respiratory distress. So due to diabetes, their lungs may not get mature. So once delivered, they can have respiratory distress. Another important thing is the neonate can be prone for hypoglycemia, low blood glucose. This is very, very important. So always infant of diabetic mother, we should monitor the blood glucose frequently in first 1 or 2 days up to 48 hours, because these kids are prone for low blood glucose. Very, very, very important. Always we should give history of diabetes during pregnancy where you are getting admitted, and neonatologists should take care of this. So they should check the blood glucose frequently so that the baby doesn't go into hypoglycemia. So these are the important complications which can happen both in the mother and the fetus. And after that, it's very important to monitor. So once delivered, after 6